Welcome to our presentation on depression among Latin American women in the United States. To begin, we'd like to start with some context. According to the World Health Organization, 350 million people suffer from depression around the globe. Additionally, Hispanic women living in the United States are 70% more likely to experience depression than Hispanic men. The main question that needs to be asked is as follows. Why is depression so prevalent among Latin American women? One place that we can look to in order to answer this question is the culture that exists in the Latin American community. The use of folk medicine to treat depression is a technique that is passed down by generations. This folk medicine, or curandismo, is typically used by Latin American women in the place of mainstream health care. Additionally, many Latin American women break from their tradition of embodying the values of Marianismo, which is the belief that the women's role is to be a good mother, wife, and homemaker. This break from tradition separates many women and their children, which can lead to depression. Another source of depression among women in the Latin American community is social status. Factors like education, economic status, and immigration status make up what defines social status. Typically, Latin American women who have been diagnosed with depression are less likely to receive or undergo treatment for three main reasons. These are low income and financial reasons, fear of unnecessary treatment, and lack of recognition for the need of treatment. In order to change the way we treat depression in Latin American women, we need to change the way we think about the process. The first step is to understand the Latin American community. Different regions, different countries, have cultural differences that influence patients' views on mental health, and these differences extend to Latin American women. For example, familial roles and responsibility for Latinas will negatively affect the likelihood of treatment. Additionally, newly immigrant women will have less contact with family in their home countries and are subject to loneliness. All of this is to say that it is crucial to know the acculturation process and its effect on Latin American women.
Hello, doctor. You have a new patient.
Hello and welcome to our role play. In this role play, we will meet Manuela Hernandez, who is a Mexican woman visiting a clinic as a follow-up visit to a previous appointment where she expressed concerns regarding her emotional health. In this visit, we will see how Dr. Julian is able to help Manuela to understand what depression is and how to break a very common stigma that lies amongst depression for Latin women.
Speak with another doctor to get some more help. Okay, well, I see in her notes that it says that she's been feeling depressed, but that she wasn't exactly sure what that meant. Is that still the case today? Well, she said that she was confused during her visit on what she's supposed to do and how to make the situation better. But she is eager to talk to you and I think needs some further explanation on what depression and mental illness is. Okay, well, I will go talk to her then. Thank you. Hello, Manuela. I'm Dr. Hallie Larson. How are you doing today?
I'm okay, doctor.
Hey, that's good. So Manuela, I saw that you recently visited with someone at our free clinic just to go over how you were feeling, and I was hoping that maybe you could talk to me about some of those concerns that you were having.
Yes, I've been feeling, weird lately. I felt different than I normally do, and I feel I'm tired all the time, and my mind is constantly racing, and I don't feel like myself. I don't feel happy or motivated. I just feel weird.
Okay, well, I saw in your notes that you recently had a baby. Do you believe that any of these feelings could have anything to do with that recent change?
No. My baby isn't causing the problem.
Oh, no, Miss Hernandez, no. I mean, do you feel that these large life changes could be making you feel different, perhaps even depressed? Have you ever heard of depression or even postpartum depression?
See, but I don't think that's what's wrong. I think it has to be something else.
I understand that this word can often be viewed as maybe something bad or something scary. But I don't want you to misunderstand that depression is a very normal thing, especially for women in your situation. Actually, in this country, 1 in every 8 women will experience depression in their lifetime. Depression is a mental disorder that can be characterized by maybe not enjoying your normal activities that you used to enjoy, by low self-esteem, by a loss of interest in many things, low energy, or maybe even pain that you don't know where it's coming from. And it can make it difficult to do daily tasks, which is something that you just mentioned has been difficult for you. And it also makes it hard to feel, as you said, normal.
I think that's what I've been feeling lately. It's hard to stop working and just be a mom. My whole life, my mom has worked and she never complained or anything. Yet, here I am. And it's been so difficult to move forward. And I just need to get over myself. Unfortunately, I'm not as motivated as I used to be, and it's affecting how I take care of myself and my children.
Manuela, depression is something that can be very common when big changes happen in our lives. And one of the ways to feel okay again is to not feel so alone. Have you ever been to therapy before?
No, I haven't. How would that help? I don't want to pay money for someone to talk to me for an hour. I can talk to my family.
Well, in reality, therapy is about talking to someone outside of your life to help you work through things. And I can even give you resources for Latinas like you, so that your therapist will understand what you're going through in this moment. This is a pamphlet for a website called therapyforlatinx.com. They have low rates for sessions, so you won't have to pay too much. And they also have all counselors and therapists who are Latino, just like you.
Are you sure therapy will help? It's not like I have a mental illness or anything.
I understand where you're coming from. Going to therapy doesn't mean, though, that you have to have a mental illness. It's just about going to a safe place where you can talk about your feelings without feeling judged. But if you are uncomfortable with going to therapy alone, I do have some other options that we could try.
Are there other options?
Yes, of course. You are not alone, Manuela. A lot of different women are going through the exact same thing that you are, especially with being a new mom. So there are a lot of mommy groups out there where you can meet with other moms from similar backgrounds that are going through and feeling similar things to you. You can get together with those other moms who may be feeling a little confused or not feeling like themselves either. And this can sometimes help reduce the stigma or the negative feelings that we have around therapy. It's just a more casual version of it.
Okay. I mean, that sounds a little less intimidating.
Okay, well, we can do whatever you think will be best for you and whatever makes you feel the most comfortable, okay? The whole point of therapy, though, is that we deal with what we're feeling and we don't have to feel so alone. We are here to help you with anything you need, but remember, you also need to help yourself. Treatment starts with accepting that there's something that needs to be dealt with, okay?
See, doctor, I just want to go back to my normal life and my normal self.
All right, sounds good. Well, I will have the nurse give you some more pamphlets of some local mom groups that we think might be really helpful for you, and then you can decide on what's the best option for you, okay?
Thank you so much for your help and understanding.
No, Manuela, thank you for coming in. Have a good day.
Thank you for watching our presentation today. We hope that you were able to understand that there is a great epidemic amongst Latin American women in the United States and depression. Latin American women are more likely than any other group to have depression in the United States, and the factors that often lead to depression are relationships, family, work, and economic status. In order to address the disparity between Latinas having depression and their female and male counterparts, it is important to end the stigma around mental illness and therapy amongst Latinos. We hope in our role play you are able to see how a doctor can help assess a patient by being culturally aware of that stigma and how certain patients might feel towards therapy, and on top of it, how they feel about depression. As Latinas understand furthermore what depression is and what mental illness is and how it can be helped, doctors will be able to do a better job of assessing it, diagnosing it, and inherently helping to end the epidemic as it can be prevented as well. Doctors have a special and unique opportunity to help Latinas to receive help and to help them gain awareness of what depression is and how they can get help that would be best suited to their needs. We hope that you enjoyed our presentation today. Thank you.